So just to give you a little bit of a background, my name is Martha Wingate. I am the chair of the Department of Healthcare Organization and Policy. I have been on faculty at UAB since 2005. And in addition to me within the department, we have 14 full-time professors. We have 7 full professors, including Dean Irwin. He's actually part of our department. 3 associate professors and 4 assistant professors. Dr. Garton, who I jumped on at the end of Hannah's presentation, Dr. Garton is actually faculty in our department as well. And then we have 5 emeritus professors that help us in many ways in terms of research and teaching. So this idea of, what is HCOP? So Healthcare Organization and Policy, what does that really mean? So really our main goals are to answer the following questions. How can leadership and management enhance the work of public health organizations and agencies? And how do laws, regulations, and programs protect and enhance the public's health? And in the current situation where we are, you can imagine that these 2 questions are rapidly being answered, and the game is changing as rapidly as folks are able to answer these questions related to COVID-19. So I think a lot of relevance, not just within infectious disease specifically or epidemiology, but all of public health. So really just kind of thinking through what that means at this particular moment. So really you can see here that the first question focuses on the organization, second question focuses on policy. And this is the slide that I like to focus on and talk about big P, little p. So we have, when you talk about big policy, that's really talking about the laws and thinking about using the example of quarantine, for example, that's big P, or the CARES Act, big P, in terms of sort of that policy piece. And little p is more of the little policies related to organization management, programmatic activities of public health. So we have the organization and management, or the business of public health, where we have a focus on leadership and finance. We have the health economic side of things. We have a number of health economists in our department, and they really focus a lot on the legislative aspects of public health, health insurance, legal issues, how do policies drive behavioral changes. And then we have clinical outcomes, which is really focused around our MSPH program. And that's thinking about things within hospitals. What are the most cost-effective treatments? How do we help physicians or clinicians make good decisions related to treatment and outcomes? And then we have the programmatic activities. So a number of our faculty are highly involved with the work of public health. So really supporting the work that's being done on the front lines of public health, and assessing, evaluating, and working with populations around interventions. And then the context for that, for many of us, for our scholarship and for our teaching, we have maternal and child health, which is one of our MPH concentrations. And then we have global health, which, as you heard, is a certificate program, but those faculty are affiliated with our department. And then again, as I mentioned earlier, with the public health practice, we have a lot of folks that, the way that I like to say it is, if we're connected to public health practice, it kind of keeps us honest in the classroom. So really trying to bring that real world experience to the classroom. So for example, we have faculty that are working with our state Medicaid office around evaluation of projects and programs. We have others that are working on evaluation projects with home visiting programs. So really trying to bring that real world public health to the classroom, and to our teaching, and bringing our research, scholarship, et cetera, into the classroom. So you may be asking, what will I learn if I get a degree from our program? So it's really based on the degree and the concentration area. So I went through those, and I'll hit them again in a slightly different way. So with our MPH degree programs, and I know Brenda is going to go into this in more detail, but the MPH is really implementation and practice focused. So if you're interested in doing the work of public health, the MPH is where you want to focus. So that is our healthcare management, health policy, and maternal and child health. The MPH is really a practice-based degree. MSPH is our outcomes research degree, and that's very much research focused. And the DRPH is sort of a combination of both. We have implementation and research. So basically, we have our three concentrations of healthcare organization and policy, maternal and child health, and outcomes research in our doctoral program. But the DRPH combines that practice and research to where you can sort of be a translator, if you will. So those are our degree programs, but I do want to make sure that if you're interested in a master's, that there's a clear delineation between, if you say, I really want to do research, then an SPH is probably the right degree for you. But if I really want to have a better understanding of how public health fits into what I do currently, or expand upon, into something different, the MPH is probably where you want to go. So just make sure that you're thinking about that moving forward. So the final question that you still may be asking yourself is, what can I do with a degree from the UAB School of Public Health, Department of Healthcare Organization and Policy? And I've laid out all the different options, sort of how we are set up as a department, the areas that we focus on. But I think regardless of what direction you take, you're going to make a difference. And that's really the key to all of this.
We're going to start with just the application process, just a recap of the application process, just to let everyone know. Once there are specific requirements, and I think Hannah went over those things this morning, but just to let you know, for our department specific, as you know, the GRE is not required anymore. So we do weigh heavily on looking at the other parts of an application, which is the GPA, the statement of purpose, as well as the recommendations. So in regards to just the GPA, the minimum requirement is a 3.0. In regards to the statement of purpose, we ask, especially for students who are looking at applying now, we ask that you at least have a maximum of 2 pages. If you go over, that's fine, but try to stay within that maximum of 2 pages. One of the helpful things that we ask is that your statement should not be a summation of your resume, because we'll have your resume. So what we need to know specifically is why you want to get an MPH and what your plans are to do with the as far as an MPH. Some students in their statement have had some experiences that it's kind of like an aha moment for them and why they want to do that. That's okay if you want to take us through your journey. But again, try to stay within that 2 pages. In regards to your recommendation, the same thing. When you ask someone to write a recommendation for you, if you would please stay within, try not to give them a copy of your resume and say, please write me a recommendation. I think a rule of thumb would be good to go ahead and let them see your statement so they'll understand and know why you want to get an MPH, have a conversation with them. We ask for 3 letters of recommendation, and of those 3 letters of recommendation, 2 should be at least faculty. If you're working in the area of public health, it's okay to have a supervisor, or if you've been volunteering in the area of public health or healthcare, that would be fine too, to get your supervisor or your internship preceptor, but just kind of stay along those lines when making sure that you're getting recommendations. Again, it should not be a summation of your resume. So you've put your application in, your application has been sent to the department, and now it's up to the department to make a decision. So I just kind of wanted to walk you through that process. So we received the application in the department. You will also receive an email letting you know that it has been sent to the department. So depending on what specific program, whether it's MPH or MSPH or DRPH, it will go to that specific committee. In regards to what the committee is looking for, again, the GRE is not part of it. So what they're really what the decision is really weighing heavy is on your GPA, your statement, and your recommendation. So I always tell prospective applicants to make sure that you spend a little bit of time, make it really polished as far as your statement. And those are the things that are going to, what they really weigh heavily on when making a decision. Once we receive the application within the department, you will get a notice telling you it'll be about 3 weeks. We try to stay within a 1 week time period. However, that all depends on, whether the committee chair or committee is available to review before we have conferences. So it just kind of depends on, at that time, what's going on in the department. But we really do try to stick within that 1 to 3 week time period. If for some reason it's over the 3 weeks, you can jot me an email and say, oh, has a decision been made? But if it's between that 1 week time period, don't email me, just wait and be patient, and we will get a decision. So once that decision is made, we will send the information back to the School of Public Health Admissions Office, and they will send the decision directly to you via email. If accepted, you will get an email from me telling you what the next steps are in regards to registering, getting your letter from the graduate school. You'll get another letter. And just FYI, if you're admitted and you get a admission email from us, you are accepted. So when we ask you for the next step to go to the graduate school, don't think that they have to make a decision. They just have to process the admissions decision in the graduate school. So once you get that acceptance email from School of Public Health, it will come from Dustin, then you have been accepted to the program. So don't think that, oh, we got to go to the graduate school and they got to make another decision. That's not the case. You are accepted. So an email is sent to you, you get a congratulations email from me, and then the next step that we try to do is look at you meeting with me once your application has been processed through the graduate school. You meet with me and we talk about, what does your plan of completion looks like? And plan of completion is basically getting you through the curriculum, and we'll look at that in a little bit, but just getting you through, do you work full-time? And if you work full-time, then we might want to look at something, not a full-time schedule. But just to kind of, just a reminder, the MPH concentration, you can complete the MPH and the MCH completely online. The MSPH is online only. And going back, the HCO and MCH concentration can be done on campus and online. So I should preface that. And then the MSPH is online only, and the DRPH, it is on campus degree. So what constitutes as far as a full-time schedule? So a full-time schedule is 9 hours, 9 hours or more. So that's different from undergrad. Undergrad, it's 12 hours, but in graduate school, it is 9 hours. Most of our degrees is about 44 hours total for the curriculum. And so if you're full-time, you can complete your program between 4 to 5 semesters. We are going through some curriculum change, so that may be, it may start at 5 semesters, it just depends, but I just wanted to put that 4 to 5 semesters. If you're going full-time, that's 9 hours. If you are at part-time schedule, you're looking at less than 9 hours. And that means you will probably extend it to like 6 to 8 semesters. I've had questions in the past, if I start off part-time and could I get a feel for the classes and then go up to full-time? Yes, you can do that. That's not a problem. Also, this is one of the rules that I have when talking to students about their plan of completion, because I've seen it over and over in the past years that I've been in this job, is that students who work full-time, usually part-time schedule works better, just because of the demands of the class and the demands of work. Sometimes it's a little bit too much. Again, we can always start off full-time and then back down to part-time. But I would say if you're working full-time, look at doing part-time. Students do have the flexibility of how they enroll. You can, again, that's the part-time, full-time schedule. The other thing in regards to, let's say if you are on-campus student and you decide that you are working and you want to take an online class, you can. Same thing goes for an online student. If you want to take an on-campus class, if you're on campus and want to take it online, you can take an online class. Just remember that there are some specifics. If you decide or online student and start an on-campus class, you'll have to go through all the health and wellness checks in regards to being a student on campus. We will review the plan of completion each semester just to see if we are staying on the plan or if something changes. I always tell students if something does change, check with me first so we can make sure that we go through we make sure that you are graduating on the time that you want to graduate.
On the recommendations I don't know if anybody is interested in the doctoral program. But I think the more information that you can give us about your interest, research interest, et cetera, and sort of where you want to, what your goals are, the better that is in terms of helping us make sure that we have the right tools to help you get there. So with the MPH, MSPH, it's a little bit less maybe research oriented on that, but just wanted to mention that for the doctoral program.
Also, just wanted to kind of let you see what the curriculum plan looks like. We have concentrations within our department. There's healthcare organization and policy. We have health policy, maternal and child health, and the MSPH program. And just talking a little bit about the curriculum again, the curriculum is 44 hours, and that is in both the HCO and MCH, which are probably the most number of students between HCO and MCH, and then we have the MSPH and DRPH. But I just want to kind of let you see just a little bit of what it looks like in regards to the core. This is a new core that we're starting coming fall 2020. Each specific concentration, everyone has to take the core. Then in regards to the concentration, we do have some courses that overlap that are in the same as far as the concentration. If you look, HCO 600, HCO 604 and 609, that is would be in each concentration, 600, 604, except health policy, and then maternal and child health. And then going back, the concentration requirements, it's very specific to that particular concentration. There are some differences as far as the courses themselves. Again, with MCH, of course, they'll be looking more at foundations of maternal and child health and development, and life course. So those specific courses are very specific to that concentration. Everyone has to do an internship, and I know Mina went over that a little bit, and the only thing I think I would add to as far as the internship is to, if you are doing the internship, let's say you enter the fall and spring, because the core has to be done first. That's a requirement before you can do an internship. Once you do the core and you decide you do the internship in the fall, you completed it in the spring, and you want to do your internship in the summer, you really need to be looking or thinking about what you want to do that internship in, and have all the paperwork done by spring, the middle of the spring semester. As Mina said, we do have a whole support system in regards to helping students look for internships. Elena Kidd is our contact person for internship for our department. There's information about internships that go out in the student newsletter. Speak with Mina. So know that we're not leaving you by yourself. If you are a student who is out of state, Elena can help navigate that as well and look at some of the internships that we've done in the past, and maybe in the state that you live. And if not, you can look at possible organizations that are on our list. So you can decide what type of internships that might best suit you. You might want to do something cold, but Elena is your first stop and looking at what type of internship works best. Going back again in regards to the curriculum, everybody has some of the electives, and that's in each curriculum. Everybody has electives. Just for electives, some students know exactly what they're interested in. That is a time for you to look at, okay, I might be interested in working in a healthcare facility that works with children. And so you can pick some of the courses from maternal and child health as your electives. The same thing so you can pick some of the classes as your approved electives within healthcare organization. Also, I've seen where students in healthcare, in maternal and child, want some of the classes in healthcare organization. So this is a time to kind of experiment, look at classes that you might be interested in. We have other electives specific in maternal and child that if you're interested in perinatal, you can pick a perinatal class as your elective, or reproductive health. So it just kind of depends on how you want to make it your own. I can go over that with you as we do your plan of completion. We also don't limit our electives within our department. If you're interested in looking in other departments in the School of Public Health, we can talk about those as well. We do have students going across the board from one department to the other, looking at courses that interest them. So just to let you know that. And then the very last thing in regards to the curriculum that everybody has is that we do have the PUH 695, which is a capstone course. So just want to kind of bring that to your attention as well.